Bismillah Rahman Rahim. Assalamu alaikum. Welcome into the fifth episode of our workshop on management of diabetes mellitus in the month of Ramadan. In the last episode, we discussed management of type 1 diabetic patients, those who are on insulin. We discussed the adolescents as well as the adult patients who are using insulin for the control of their diabetes. As mentioned in the last episode, today we are going to discuss management of type 2 diabetes patients who are using oral drugs or who are using insulin or who are on the combination of orals and insulin. How to go about it, what changes we need to make in their drugs, in the oral drugs and in their insulin. So be with me. Today, we are diving deep into the management of type 2 diabetic patients in the holy month of Ramadan. It's the fifth episode of our workshop. And as mentioned in the last episodes, we are going to discuss type 2 diabetes mellitus in the month of Ramadan. Ramadan fasting among people with type 2 diabetes can present many challenges. The key concerns relate to uncontrolled blood glucose levels that can lead to hyperglycemia and or hypoglycemia. Especially those patients whose blood sugar is not controlled, it really poses a great challenge. Appropriate and effective blood glucose monitoring and medical management of type 2 diabetes is crucial to ensure safety during Ramadan. We need to adjust their medication, and this is very, very important. The type of medication the patient is taking for the management of their diabetes influences the potential risks that fasting during Ramadan may lead to, and therefore requires careful attention when formulating the treatment plan. This is very important. When before Ramadan, you make the decisions and you give them a trial that during Ramadan, what their medication adjustments will be needed. The primary concerns relating to these medications are their risk towards hypoglycemia. There are a couple of drugs which can lead to hypoglycemia. There are a couple of drugs which can lead to dehydration. Particular care must be taken when individuals are on multiple anti-diabetic therapies, and the healthcare professionals' advice need to account for this when making dose modifications during the pre-Ramadan assessment. So this is very, very important that you assess all drugs and you see which drugs can cause hypoglycemia, which drugs dose can be reduced, and which drug timings can be changed from morning to the evening. Anti-diabetic drugs such as metformin, acarbose, TZDs, GLP-1 receptor agonists, and DPP-4 inhibitors work in a glucose-dependent manner and generally have a low risk of hypoglycemia. These drugs generally don't require any dose modifications during Ramadan. So this is a common principle or a general principle. Short-acting insulins, secretagogues, are also safe for use during Ramadan. Therefore, it is recommended that the normal 3-meal dosing is redistributed to accommodate the eating patterns, that is the iftar and suhoor during Ramadan. Modern sulfonyl ureas like glimepiride, gliclazide, and gliclazide modified release, they carry a slightly higher risk of hypoglycemia and therefore should be included in the pre-Ramadan assessment. Specific attention needs to be given to these. Sodium glucose cotransport 2, that is SGL2 inhibitors. What about these? For stabilization, SGL2 inhibitors should be initiated at least 2 weeks to 1 month prior to Ramadan. SGLT2 inhibitors are recommended to be administered at the time of evening meal, iftar. However, if the indication for SGLT2 inhibitors initiation is cardiovascular or renal protection, then the pre-Ramadan initiation should be conducted with a lower dose. So these are the few specific points which you need to consider when you prescribe SGLT2 inhibitors. Increasing fluid intake during the non-fasting hours of Ramadan is recommended when a patient is using these drugs because they cause dehydration. SGLT2 inhibitors do not require treatment modifications during Ramadan. The dose remains the same. However, if an individual is on multiple medications, a review of the doses should be made to avoid the risk of hypoglycemia. This is important. When they are solely on these, then they don't need dose modifications. But when they are on multiple dosages, then their dose modification is required. When a patient is on insulin treatment for the control of their type 2 diabetes, insulin used during fasting carries a risk of hypoglycemia, especially when more complex insulin regimes are used. And so extra care and caution must be taken when developing Ramadan medication regimes. So this is specific caution about those patients who are using insulin. Remember, administration of insulin via subcutaneous, intramuscular, or even intravenous routes do not cause a breaking of the Ramadan fast. So remember this. There is misbeliefs in patients, and when they will get the insulin, it will break the fast. There is a fatwa about this, that these do not break the fast. Let's discuss these drugs in more detail, starting from the oral antidiabetics. First, take the metformin. If the patient is on once daily dose, then no dose modification is required, except that if the patient is taking the drugs in the morning, this metformin OD dose should be taken after iftar during Ramadan. So the morning dose is changed to the evening dose. If a patient is on twice daily dose, then again no dose modifications, and take at iftar or suhoor, and they can be using the same dosages, provided if they use the same strength. Suppose if a patient is using 500 milligram metformin tablet in the morning and 250 milligram metformin tablets in the evening in the non-fasting days, or suppose 1 gram in the morning and 500 in the evening, and the sugar is controlled, then you switch those. The lower dose should be in the suhoor and the higher dose should be in the iftar. If the patient is on 3 timely dosage, daily dose, for example, taking 500 milligram 3 times a day, then the morning dose taken before Sohar and the combine the afternoon dose with the iftar dose. So what you do, that the morning dose should be the same and the lunch dose or the afternoon dose and the evening dose, you combine them and you should be taking this in the iftar time. Prolonged release metformin drugs, no dose modifications, and if the patient is taking in the morning, it should be taken in the iftar. Coming to the second drug, the icarbose, again, no dose modification is required for this drug except the timings. That if the patient was taking in the morning, it should be taking in the evening time. Then the TZDs, that is the pioglitazone, again, no dose modification, but dose can be taken with iftar or sohar, but preferably I tell them to take after the iftar. Then the GLP-1 receptor agonist, semaglutide, and the others, no dose modification after appropriate dose titration have been achieved. These are the weekly dosages. Then the DPP-4 inhibitors, vildagliptin, sitagliptin, no dose modifications. One thing is that they should be used after iftar, not then at the suhoor, because they do cause urination and dehydration may be a problem. For the SGL2 inhibitors, dapagliflozin, empagliflozin. If the patient is using the dapa and empagliflozin, and in the morning, they should be changed to the iftar time because they do cause dehydration. And the vildagliptin can be taken in the morning or in the iftar time. I personally, if the patient is on OD dose, I tell them to take after the iftar because the chances of hypoglycemia, so-called hypoglycemia, is minimized here. The problem with these two is that they cause urination, so I prefer them to be taken in the iftar time. This is all important. And of course, in the non-fasting hour, the patient should be using, should maintaining the good hydration. Coming to the sulfonylureas, the glimepiride, gliclazide, and gliclazide modified release. If they are on once daily dose, reduced dose in well-controlled individuals, and they should take this at the iftar time. If the twice daily dose, the suhoor dose should be reduced in a well-controlled individuals. And if a patient is on the insulin, then there are specific recommendation for these. If the patient is on long or intermediate acting basal insulin, then the like NPH, detamar, glargine, they once daily. So reduce the dose by 15 to 30%, and it should be taken after the iftar. And those who are on the NPH, detamar or glargine, who has twice daily, they take usual morning dose at iftar and receive the evening dose by 50% and take that at the suhoor. So you change the timings. And in the short-acting insulin, normal dose at iftar, omit the lunch time dose and reduce the suhoor dose by 25 to 50%. So these are the type 2 diabetic patients who are using the insulin. Similarly, changes to pre-mixed insulin dosing required in Ramadan for type 2 diabetes. Once daily dosing, take normal dose at iftar time. You change from morning to the iftar. Twice daily dosing, take normal dose at iftar and reduce the suhoor dose by 20 to 50%, the morning dose. And 3 timely dosing, those who are using 3 injections, omit afternoon dose, adjust iftar and suhoor, and then carry out dose titration every 3 days, depending upon how the patient responds. And this the changes which are needed for when there is a fasting, pre-iftar, pre-suhoor blood glucose. When it's less than 70 milligram or there are symptoms, then the basal insulin should be reduced by 4 units, and short-acting insulin in the pre-iftar and in the post-suhoor, it should be reduced by the 4 units. The basal insulin and the short-acting. If the sugar is less than 90, then reduce the dose by 2 units or each. When it is 90 to 126, no change required. When the patient is using the insulins and you check the blood sugar, and if the fasting blood sugar is found to be 120 more than 126, though you increase each by 2 units, and it is more than 200, then you increase each by 4 units. This is the simple calculations. You can find all these in available charts. So in case of the type 2 diabetic patients who are on insulin, their regular monitoring is important, and you decide accordingly after 3 to 4 doses whether the patient needs to decrease the dose or increase the dose. What about special populations? The pregnant women with diabetes and elderly individuals with diabetes. These are the two groups, a special population who need special care when they want to fast during Ramadan. And we shall discuss these special population groups in our tomorrow's vlog. So be with me. See you tomorrow